Hey guys, this is Dr. Samir Islam. I want to thank you for joining me today. In today's video, we will talk about, do you have IBS, or how do you know if you have IBS? For those of you guys who are joining me for the first time, my name is Dr. Samir Islam. I am a board certified GI doctor. Yes, that is a poop doctor. I specialize in poop and the GI tract, and I practice here in Texas. And my passion is to give you accurate information based on your health that you can take to help out with some of your gut issues that you may be having. Now, in today's video, if you like this video, I'd encourage you to subscribe to my YouTube page, subscribe to my Facebook page, where every Tuesday around this time I do a Facebook Live, and also follow me on Instagram as well, where you can find out what it's like to be a poop doctor like me. But in today's video, we'll talk about a couple of things. Number one, the biggest question people ask me, do I have IBS, or do you have IBS? And if you wait till the very end of the video, I'll give you two main tips. Number one, what are the not typical symptoms of IBS? And then also I'll give you a sneak peek of a treatment program that I have for IBS. For any concerns or notes, please look down below in the description. I put all my links down there as well. And if you want to subscribe to my newsletter, which I have all my information for gut issues, I would encourage you to comment or click on the link down below. But in today's video, let's talk about, do you have IBS? So when we have somebody who has IBS, which stands for irritable bowel syndrome, there is a workup that we have to do for IBS, because not everyone's symptoms who have IBS type symptoms may have IBS. There could be other things that could be going on, whether it's a condition like ulcerative colitis, Crohn's disease, maybe a condition like small intestinal bacterial overgrowth, or any number of different issues. And so there's a workup that we'd have to do. But the biggest part of this workup actually is getting a very good history and physical. By far, talking to our patients, listening to our patients, hearing your story would give us probably the most accurate information, better than any tests, better than any blood tests, better than any imaging, to allow us to know if you have IBS. In fact, this alone, listening to our patients and listening to you, can give us the information that we need to help diagnose our patients with IBS. And a confident diagnosis can be made as long as you fit the clinical criteria of IBS, in which you have typical symptoms for at least 3 months, in which you have a normal physical exam, and you don't have any of the alarm features or features that are not typical of IBS, which I'll talk about at the very end of the video. If you fit this category, and if we can find this out just by having a simple discussion with our patients, this alone will allow us to diagnose our patients. And because of this, there's a lot of repeat testing that does not need to be done for a lot of our patients. And we don't have to consider IBS a diagnosis of exclusion, meaning we don't have to exclude all the other things that could be going on, Crohn's disease, ulcerative colitis, celiac disease, and whatnot. Now, there may be something within the history in which we speak, in which we talk to you, that makes us think that something else could be going on beyond IBS, beyond the typical things that we see when we have IBS. But if I have somebody in my clinic with typical pain that gets better or worse with bowel movements, lasts for about 3 months, and there are no warning signs or alarm features that are there, I have about a 98% probability of diagnosing somebody with IBS. Now think about that. That is such a high percentage. By just listening to our patients, that's all we really have to do. And so I'll encourage you to have that conversation with your healthcare provider about whether you may have IBS by actually having a discussion and explaining what your history is and explaining kind of what's going on with your gut symptoms. Now, the typical symptoms for IBS include pain that seems to get better with bowel movements. You can also have a range going from diarrhea to constipation, and that diarrhea or constipation does tend to get relieved with bowel movements, including the pain that occurs as well. This has to be present for a few months, and that will allow us to diagnose somebody with IBS. Now, there are some people who may have some history that may not be totally classic for IBS, or you may have traveled to an area that may make you more prone to develop more of a gut infection. So for some people, we do have to do stool studies. Maybe we're going to check for other conditions that can mimic IBS, including a condition called C. difficile colitis, which is a really bad diarrhea. Or for some people, we may be doing stool studies to see if there's any inflammatory markers that could be present that is not typical for patients who have IBS. For some people, we don't quite know based on the history and the stool studies, so we have to actually maybe take a look with the scope. And so a scope is one of the gold standards that we can use to help us to rule in and rule out certain conditions. It's very good at ruling in conditions like Crohn's disease and ulcerative colitis, and maybe for some people we can also see there's bad bacteria within the small intestine called small intestinal bacterial overgrowth. And for those patients who we recommend doing a scope, we may do that because A, we're not quite clear about the diagnosis. Number 2, you may have symptoms that are not consistent with IBS, or number 3, you may have some of the warning signs that we worry about for patients who come to see us that makes us think that something's going on, the typical IBS type symptoms. And also, we do age-appropriate screening, including routine blood testing. And if you are over the age of 50 years old, you've not had a colonoscopy, you're coming to us for IBS symptoms, we're probably going to recommend a colonoscopy, not because we're necessarily worried about something going on in your colon, but you're due for one anyways. So if you're of the age to get a colonoscopy, you've not had one, most likely we're going to recommend that as well. But by far, the biggest thing that we can do to help diagnose our patients with IBS is just history alone, listening to our patients, and that will give us the idea that we need to say if this patient may have IBS or not, and based on that we can do our workup if we need to, or at least maybe start you on treatment if we think that may be the best thing for our patients. But the most important thing beyond that also is that there's not one test that's going to tell me that you have IBS. I cannot do one simple test, no matter what you may see on commercials, that's going to say, hey, you got IBS, that's it. The best test is me just listening to you, and that's it. That's all we really have to know. There's not one simple blood test that will tell me you have IBS. There's not one simple scope that's going to tell me you have IBS. It's usually a constellation of different things, but the most important thing that we can offer our patients is just a simple conversation. And if you have the typical symptoms of IBS, you don't have the warning signs, that's all we basically need. Now here are the things that IBS should not do. When we hear this from our patients, this makes us think that something else could be going on inside the GI tract beyond the typical IBS. So number 1, IBS should not wake you up from sleep. You should not get up from a sound sleep in the middle of the night to have a bowel movement or to wake up from pain. That is not typical for IBS. And there may be something else going on within the GI tract in which we want to evaluate. Number 2, you should not have a significant amount of vomiting. Vomiting is not, especially a large amount, is not typical with IBS. And so if you're having a lot of nausea and vomiting, and you're thinking this may be IBS, it may not be. There may be something else going on inside your GI tract. Significant weight loss is not typical as well. Now you may have some weight loss with some of the diarrhea, but not a significant amount, especially unintentional weight loss. That is not typical for IBS. If you're having gut issues with a lot of weight loss, make sure you speak to your healthcare provider about that, because that is not normal, and don't just blow that off. Things like night sweats also is not typical for IBS, and so make sure you get that checked out as well. And if you have pain that's associated with other conditions including anorexia, malnutrition, or weight loss like I mentioned before, or pain that's out of the ordinary, that is, or in extreme, that is not typical for IBS, so don't feel like that can be explained just with IBS symptoms alone. It's not, and it can. I wouldn't use that as a marker for IBS. And lastly, diarrhea is very common with IBS, but the diarrhea with IBS should not be a large volume, should not be bloody, it should not get you up in the middle of the night, nor should it typically be greasy. If you have diarrhea that's like that, something else may be going on to explain your symptoms beyond the typical IBS. And so keep that in mind as well. These are things that IBS should not do. Now I am really proud to offer a treatment program for our patients with IBS. Now I'll have a link down below, or we'll be opening this up pretty soon to the general public. But for my patients who subscribe to my newsletter or subscribe to my YouTube or Facebook channel, I am offering an online course for IBS. If you think you have IBS, or more importantly, you actually have been diagnosed with IBS and you don't know exactly what to do, you're looking for a more of a natural way to treat your IBS, I have the course for you. I would encourage you to go to my website. I'll put the link down below in the description where you can see if this is the course for you. But for those patients who suffer from IBS or are not happy with the treatment program you've gotten from your doctor for IBS, or you're wondering if there may be a better option to treat your IBS besides taking medications, this is going to be the treatment program for you. I'm offering a select group of my patients to get into this program, so make sure you be one of the very first few to hopefully get an effective treatment option for our patients with IBS. But in summary, keep in mind that IBS is a symptom-based diagnosis. The history alone can allow us to see exactly what's going on. There is not one simple test that's going to let me know if you have IBS, except for the fact that us talking to you is all we basically need. And keep in mind what IBS should not do. That's also very, very important, because there are a lot of things that people think could cause IBS, but something else could be going on. And it's very important for us to make sure we don't miss anything bad that could be going on within your GI tract. So my question today for you guys, what tips did you pick up from this video? What did you think was part of IBS but actually wasn't? Or what things do you think may be helpful in terms of tips and tricks from this video? Please comment down below. I would love to hear what you guys have to say. I would love to hear what you guys, if there's any tips that you picked up from this video today. I want to thank you guys for joining me today. Every Tuesday around this time, I do a Facebook Live on a variety of topics. If there's a topic that you want me to talk about, please comment down below as well so I can know exactly what you guys want to hear. I can hopefully address those concerns. But every 7:30 a.m. on Thursday, I do a Poop Tip Thursday, where I try to give one poop bomb for the week for you to help out with your gut issues. So tune in on my Facebook page on 7:30 a.m. If you missed these videos, I always repost a replay the following week on Fridays on my YouTube page, but also follow me on Instagram as well, where I post a lot of other tips for your GI and overall health. I want to thank you guys for joining me. I look forward to seeing you guys next week. Have a great day. Thanks and take care.